My name is Dr. Yolanda Cintron, and I am a biological dentist in Fort Lauderdale. We have patients coming from all over the world and all different kinds of states flying in. So they are looking for people like you, that you have such an open mind about medicines. I have as a guest Dr. George Shapiro. I have met Dr. Shapiro in various conferences. Last time I saw him speak was at the CEO Exosomes Cutting Edge Medicine that is dealing with things that the general public maybe don't even know. You are always a leader in innovation, not only in advanced diagnostics, regenerative medicine, longevity focused care. You have served as chief medical officer of also innovations in fountain life, which I'm very familiarized with the way that you guys treat the human being as a total person in a lot of diagnoses. So I'm so interested in your you know, information that you have because you first were a cardiologist. So tell me a little bit about you so our audience can, get familiarized to you're like an Olympian. You are so well rounded. I'm going to call you the Renaissance man.
Thanks, Yolanda. So it's nice to be here. Thanks for inviting me. You know, I've been, into longevity ever since I'm a child. My parents kind of pushed me into exercise and fitness. My dad was a masters champion in racquetball, so he used to train uh, and he used to get us involved. I'm the oldest of 6 children, and we used to play 4 boys, 2 girls. We used to play competitive racquetball, believe it or not, for years, and traveled the country. So I was, New York State champion, a regional champion, a national champion, and we did some exhibitions in the Olympics in racquetball. So that started at age 13, believe it or not. And then soon thereafter, I started to compete in judo and martial arts and went to the Junior Olympics in martial arts. So between 13 and 30, it was really starting to get fit. And what we're seeing now is I'll go into the cardiology stuff, but when you start exercising as a child heavy, you can look at your coronary arteries and you can look at the size of the arteries, and they're giant compared to smokers and diabetics, thin arteries. So, that's why childhood sports are so important. And that's why you see a lot of these programs in schools with all these kids doing soccer and sports. So for me, that's changed my whole life. And I went on to delve into science and medical school and became a cardiologist and loved cardiology. I was really doing invasive cardiology and heart transplantation. That's when I started with heart failure management in New York. And the program was really intense and it was really sick care. So for physicians who now are starting to get involved in wellness and longevity and well care, it's really important that they have a baseline knowledge of sick care medicine. And for me, it was an intense program. It was probably one of the hardest programs in New York City. It was at New York Presbyterian Columbia. What was really interesting was I got a chance to really see what it's like to be really in the depths of, sickness, real bad sickness. People with ejection fractions, their heart muscle pump 10% on the verge of dying. I said, something maybe we can start investigating why people are getting heart failure and answer that question, the why. That kind of led me more into what I'm doing now is trying to find out the why with chronic disease. Instead of just treating with a pill or a therapy, find out why and fix it. So to fix the source. And then we started getting into early detection of disease. So I was working with a company based in Las Vegas called Centro. And that's where I kind of learned age management medicine. And I learned about exercise, nutrition, hormone optimization therapy. It turns out as we age, men at age 28, women at 34, we start to lose hormones and our metabolism shifts, and we start to slowly decompensate and get body composition changes like visceral fat and belly fat. And when you have that, that leads to chronic disease. So you were mentioning before this podcast about chronic illness and chronic disease. A lot starts with what we put in our mouth, believe it or not. And when we start to develop body fat, that's highly inflammatory. And fat around the organs are really inflammatory. And that starts to lead to chronic illness. So part of what we did at Centro was really looking at the sources of these problems and try to fix it and really get involved with more of a preventative nature. One of my patients was Tony Robbins and his wife, Sage Robbins, probably about 15 years ago, 20 years ago. And we stayed in contact. And then Peter Diamandis and Tony Robbins, who I know really well, I was joined with Bob Harari and myself and Bill Kapp, and we formed Fountain Life in 2020. And the goal was a platform company with the hottest diagnostics out there, the newest innovations in technology, using advanced imaging and artificial intelligence. And a lot of people say, why would you want to do that, like a full body MRI with artificial intelligence or a new heart scan with artificial intelligence? Because you're going to find something. And that's the whole goal. You want to find something because if you find it early, we can do something about it. So we've been collecting data right now in Fountain Life for about 5 years now. Close to 10,000 patients came through our system.
Wow.
And it turns out that we're finding out what is actually resulting in disease progression, cancer progression, coronary atherosclerosis progression. And it turns out some of the early data that we have and soon to be published is metabolic dysfunction, inflammation. So biomarkers in the blood we can look at, like hemoglobin A1C, is really important when it comes to disease, chronic disease. Homocysteine, believe it or not. I remember there was a New England Journal of Medicine article many years ago that said homocystine's a waste, and it turns out it's not. It accelerates atherosclerosis, and it's an inflammatory marker, along with uric acid and insulin resistance score. So we're really looking into inflammatory biomarkers and metabolic dysfunction biomarkers leading to disease. So that to me was some striking evidence because everyone thought it was just cholesterol. High cholesterol is bad if it's in a bad environment. We have many patients who have high cholesterol, and physicians right away want to put them on a statin. How about looking at the environment cholesterol's in? If you're a diabetic with a lot of inflammation and you have high cholesterol, then you need to really get aggressive. But if you're really fit and really lean and your inflammatory biomarkers are low and your metabolic biomarkers are low and you have elevated cholesterol, you don't necessarily need to jump into a statin. You don't treat a number, you treat the patient. So what I learned throughout my career is really listening to the patient, treating the patient, answering the why, and doing a deep dive to find out about disease. I know you put together some questions that you had for me for this podcast. For
Well, you're such a wealth of information that I knew we would not need a lot of questions. But I was curious because I have patients that I get all their blood work. I want to know their C-reactive protein. I want to know the A1C. I want to know if they methylate or don't methylate. Because why is it that so many people lately, we have a lot of cancer patients with root canals, and then they're seeing doctors that put, they never look at the patient's mouth. So my goal would be to have more doctors that are practicing like you, that I do a CT scan and I see abscesses in the jawbone and I see destruction of the jawbone. Obviously, we see later on a decrease in the C-reactive protein. Somebody had a C-reactive protein of 70 with prostate and PSA, very high prostate. And then we remove the root canals on the teeth that are connected and the markers go down. They go to zero. So sometimes, like I want to see how can we elevate, like what you're doing. You're elevating medicine. And I wish that what you do was standard of care.
Well, we're trying to make that standard of care. We're actually trying to change the healthcare model from a sick care model to a well care model. We just started a program for young people in the family, age 18 to 30, to start evaluating. You really need to see the doctor, not when you're sick. That shouldn't be the first time you see the physician. But I think the big thing is educating. And I have so many patients who I would see when I was doing insurance-based medicine years ago, working in the inner city. And, they would speak to me and their breath was so horrible because they had such bad bacteria. And I say to myself, how does this person deal with this? Don't they smell what they smell like? It's incredible. And when you look at their teeth, I don't think they even brush their teeth or floss, and you see all this plaque and bacteria. So we do a few diagnostic tests on the mouth. There's a couple of tests out there today, and we noticed that there's some bacteria that are present in the mouth that are pathogenic, and they can cause different diseases. One specifically is Porphyromonas gingivalis, and that can increase your risk for dementia or mistake you for dementia. It turns out that the brain wants to protect itself, so it forms plaques, and they cover it to camouflage it, and you really need an antibiotic to kill it, but people misdiagnose. Physicians sometimes will misdiagnose and say, okay, you have Alzheimer's dementia, and put you in a nursing home. Meanwhile, you need 8 days of doxycycline to take care of it. But I know you do a lot of dentistry, and I've been hearing a lot of stuff about cavitation and all this stuff in the gums. It never should get there. It
Right.
never should get to that disease. That should be totally preventable. I floss 2-3 times a day after I eat, and I brush my teeth 2-3 times a day. I don't know how people just can't do that. It's just,
Yeah.
the oral mouth is the dirtiest. Well, it's more dirty than the rectum, believe it or not.
Uh,
Mouth. There's more bacteria in the mouth. And so we test for different bacteria, and it turns out 70% of cardiovascular disease is related to, bacteria in the mouth. It's just incredible. So it's a big deal. And we look at that a lot. So, I think the problem is modern healthcare misses these early warning signs. And what I'm seeing over and over again is that, we're confusing being healthy with being resilient. So I have many high performing patients. They look great on labs. They function well for years. Doctors reassure them everything is normal, while a subtle dysfunction is quietly building, underneath. And modern healthcare is great at diagnosing disease once you get it, but it's weaker at detecting early disease, like early disease in your immune system, or toxic loads from environmental toxins, food toxins, mitochondrial dysfunction, or low-grade inflammation. And a lot of people don't even understand, what does that mean, mitochondrial dysfunction? By the time symptoms appear, our system's already it's compensated poorly. And the warning signs were there, we just missed them. So, patients feel like, how come this wasn't measured or connected? I think a lot of doctors really didn't understand and know, but the patients, didn't know either.
Right. Well, part of the, like you were saying about the infection in the gums, you can take antibiotic, but the dentists have to actually eradicate the actual bacteria and the calculus and all the infection. We have a laser, so we kill the bacteria on contact. The mitochondrial dysfunction, we find that all patients that have mercury, which is a neurotoxin, amalgam fillings that have mercury, they are like, why am I so tired? They think that they have some kind of virus. The moment that we get the mercury out, and the patient has to detoxify after getting the mercury, because the mercury goes and affects the mitochondria and the production of the ATP. So mercury is a neurotoxin, not only in the brain, but also in the actual cell at a molecular cellular level. So from your experience, if a patient has removed the mercury, being from the fish that they ate or the teeth that they were loaded with fillings of aluminum and lead and cadmium and all these heavy metals, what we do from a medical point of view after eradication of the toxic loads, what would you recommend for a patient to do in order to get that toxic load that is in the body? Especially if you did metal analysis of toxins and things like that.
Yeah, so let's talk about how these toxins quietly accumulate, because that's really important. Most toxin exposure, like the mercury you're talking about, is a low dose, but it's chronic and it's invisible. It's not a one big event where you
Right.
get this large load. It's years and years and years of accumulation it could be from food, from water, from air, dental materials, like you mentioned, amalgams, medications, even infections, and sometimes even supplements can cause these toxins. So you mentioned mercury. There's also aluminum, but there's also mold toxins and organic pollutants living next to a golf course, getting all those toxins in you. So what the toxins tend to do is slowly they disrupt your mitochondria. We have 40 trillion cells in our body. In every cell, you have thousands, maybe millions of chemical reactions. And one reaction is the TCA or Krebs cycle that goes into the electron transport chain to make energy, or ATP. And that's what the mitochondria does. It's energy. Most people make 25 pounds of ATP a day. They need to make 100 pounds. So why do people have this mitochondrial dysfunction? And a lot has to do with these endocrine disruptors or mitochondrial disruptors from toxins. The first thing to do is to identify them, and then you want to do it the right way. You can't just take something to detox. You need to fix your gut.
Yeah.
Most doctors don't understand that. If I just gave you something like a chelation thing for mercury, you can get really, really sick. So you want to fix your gut first. So the first thing you need to do is a test to evaluate your gut. So the gut is also known as the microbiome. And we have bacteria in our gut, and you need a good balance of bacteria. What we find is most people have an imbalance of bacteria, and that's called a dysbiosis. If they have an imbalance of bacteria, good bacteria and bad bacteria, you start to have what's called leaky gut, bloating, cramping, irritable bowel syndrome. Stools are not great. You're constipated. Sometimes you have diarrhea. It's just your belly's a mess. Parasites. You can have inflammatory markers like calprotectin could be elevated. We were never taught that in traditional medicine. This is more of functional medicine, doing a deep dive to answer the question, why? So why is it so important to fix your gut? Because your gut controls about 80% of your immune system. And if your immune system is altered, your body attacks itself. And that's why there's so much autoimmune disease. And also the gut and the immune system control cancer. It's like a seesaw. If your immune system goes down and gets weak, cancer goes up. So a lot has to do with our gut. So we need tests to measure our gut. So we went through about 4 different tests in the company that I'm with right now, and we found out some tests are really good, but now they're adding AI to some of these tests. So now we're able to take the test and add in clinical protocols and research protocols, millions and millions of data references in like 4 seconds. So now we get a good idea of what's happening in the gut. So we fix your gut. We balance out the bacteria, whether it's a probiotic, a prebiotic, whether you check for H. pylori, whether you fix inflammation. Once your gut's fixed, then you can start detoxing. And there's different ways you can detox. There's a couple of companies that have some great detoxes for heavy metals. I'm trying not to name companies on this podcast, but there's a lot of companies out there that do this, and toxins are a big problem, and mitochondrial dysfunction is a big problem. So that's one of the things. So one of the things that people want to know is why how come detoxing someone doesn't work? And once you understand that it's not a product that you take, or it's not a protocol, it's a whole physiologic process. So for detox to work, your liver has to be in good shape. Your gut has to be in good shape. Your kidneys and lymph system have to be in good shape, and your immune system. All these systems have to work together. It's not just one system. So if you have a chronic infection, or let's say an inflammation in your mouth, and a chronic oral inflammation with the bacteria in the tooth, and along with that, you have impaired bile in your liver, or you have a gut issue with leaky gut, or you're missing some nutrients. What happens is the toxins, they get mobilized, they're not eliminated. So they actually make people feel worse. So sometimes when you start these detoxes, if your liver, kidney, and other organs are not working, the toxins just stay there, and you get sicker. So detox will only work when your drainage pathways are open and your body has the energy to reduce the inflammation and complete this job. The gut is really a big issue here. It's really changes everything. Gut health is so important. Immune regulation is important in your gut. Nutrients get absorbed there. So many people take vitamins every single day, not just 5 vitamins. Some people take 20, 30 vitamins a day. What do you think about that?
Well, people don't know what to do. That's why we're having a podcast, because people are getting so much information and it's incomplete information. Like, you are very comprehensive. That's why I love to speak to you. Like, I remember reading, met Dr. Levy. He's a cardiologist like you, and he did 20,000 biopsies on open heart surgeries. All the 20,000 had Fusobacterium, a type of bacteria that is in the mouth, like you were talking about, gingivalis. So the patients in general, the public, they don't know what to do. So my patients are very successful. They fly. They're taking, the vitamins. They're doing hyperbaric. They're doing colonics. They're doing everything. But they were just diagnosed with prostate cancer or breast cancer, and they're like furious because they're like, how come nobody told me that a root canal that's connected to the meridian of the prostate could have been removed, that I have a dead organ in my body? So they're doing all the things. So I'm trying to, how is it that we can see people from a spiritual point of view, and your thoughts, your heart, your diet, the physical part, we can fix it. You can do the blood work. You can say, okay, but Fusobacterium, cardiologists should have uh, all the patients do periodontal therapy and laser, so the heart doesn't get endocarditis. But
What you
they
mentioned is really important, and I just want your listeners to understand the microbiome, or the gut. It's really a turning point in health. When your gut is healthy, everything is changed. So just to summarize, the immune system and immune regulation, nutrient absorption, and inflammation signaling all intersect in the gut. And when your gut barrier is compromised, that inflammation then gets into the tissues, and then people get sick and chronically ill. When your gut's repaired, inflammation goes down. And you can see this in blood tests. Your biomarkers of CRP goes down, myeloperoxidase goes down, other biomarkers go down. Your nutrients now can get absorbed. If you have an inflamed gut and you take all these vitamins and supplements, nothing's getting absorbed, and energy is weak. People feel shocked, and actually they feel better mentally and physically. Once your gut is stabilized, your brain is like is awakened. You're no more brain fog. You just feel like sharper, like, wow, what happened? The gut's really important, and a lot of people don't understand it. We can now measure what foods will disrupt your gut and make you bloated. So let's say you have an imbalance of bacteria in your gut, and now you have a Snicker bar or a sugar. candy. That sugar is going to feed the bacteria produces gases, and you get bloated. Humans should not get bloated. Humans should not produce gas. If you eat the right foods, you have no gas and you have no
Mm.
flatulence. It's about food. So we can actually measure what foods disturb you. But I know there's certain foods that are just difficult. And a lot of GI doctors who I know and a lot of functional medicine doctors, there's like 5 things that they just don't like people to have. Corn,
Mhm.
GMO wheat, soy, gluten, bread, these seed oils, processed foods, sugars. They look good, and every day you walk into these bakeries and you see these donuts and donuts and donuts, and it's just like the worst thing I learned this, early in medicine. The worst thing you could do is have the first meal as a high sugar meal.
Right.
And we can now measure the sugar, believe it or not, in foods called the glycemic index. So, as an example, what do you think the glycemic index should be in a patient? Really under 45. Every food should have a glycemic index under 45. The only one that's carbohydrate that's really not is spaghetti and pasta. It's like 27. You know, cereal in the morning. Glycemic index 80, bagels 80, donuts 80. So when you put that in your system, your body has to respond to the high sugar. So what is it going to do? It's going to release insulin.
Mhm.
And then you feel that crash. Then you start yawning. And people notice about 20 minutes after they eat, they start yawning and getting tired. And before they eat, they had all this energy because they just woke up. And now they're yawning and they go, I don't understand. I just slept 8 hours or 6 hours or 7 hours, whatever. And I was fully awake and now I'm exhausted again after I had a donut because the insulin will bottom out your sugar. Your sugar drops. Now you're exhausted and you want to have more sugar, but the insulin takes a long time to come down. And what does insulin do? Insulin binds to your fat and it makes you fat and keeps you fat all day long. And then you eat sugar again, but the insulin is still high. So all day long, you're working on high sugar, high insulin, holding on to fat. Whereas if you had a low glycemic meal in the morning, your insulin won't rise, your sugar will stay low, or not high, and your sugar and insulin would be stabilized, and guess what happens? You're not tired, and you're burning fat all day, and you're losing 1 to 2 pounds a day just by burning fat all day long if you're moving. It's food. So we can measure now what foods bother certain people. It's a special test that we do. Part of the you mentioned like testing. We do about 150 gigabyte health upload, about 18 different tests, anywhere from full body imaging using artificial intelligence, heart scanning with artificial intelligence. We'll do an artificial intelligence evaluation of your skin, hearing, your eyes, smell. The first sign of dementia or neurocognitive disease is loss of smell. So we do certain tests for smell. We can look at your genomic sequence. What do you think genes are responsible for with disease in a lifetime? 7%. Lifestyle is 93%. So if your dad had pancreatic cancer, everyone's worried they're going to get it. It's only a 7% chance they're going to get it because lifestyle is 93%. So if you have a powerful immune system, which means you need a powerful gut, which means you need to eat the right foods, this is what's reducing chronic inflammation. I mean, chronic inflammation equals chronic disease. And now answer the question, how do we stop that? What's the why? It's what we put in our mouth. You got to start eating well, and exercise is key in longevity. Your largest longevity organ is muscle, and most people don't exercise. So I was up today at 5:30 a.m. in the gym lifting weights because men and women both need to lift weights and build muscle. You just can't walk. You just can't do the Stairmaster. You just can't do the elliptical. You need to lift weights, especially women for bones and bone protection.
That's wonderful. Yeah, I'm totally in agreement with everything you said. We see, fantastic people that are doing everything right. They're working out, they're lifting weights, they're doing 20,000 steps, more than 10,000. They're doing 20. And they're like, why do I have cancer? So the everything that goes in the mouth and is in the mouth is going to affect. Now, you mind sharing the best gut, bacteria analysis that there is? You say you use a company that do the testing for the gut microbiome.
So if you want to look at certain tests, I compared about 4 or 5 tests, and now because we have Grok and Chat and Anthropic and all these AI algorithms, patients are getting smarter. They could just go in there and they go, "What's the best diagnostic test for gut?" So there's something
Right.
called GI Map. There's something called GI Effects. There's something called Jonah. There's many different tests. I like Jonah, Jona, but there's a lot of different gut tests out there now. You really want to measure Helicobacter pylori. That's a bacteria that's easily treatable, but if you don't treat it, it can result in cancer.
Right.
So you need to fix that. A lot of people have a lot of reflux, heartburn, burping. And if you notice, if anyone notices, every time I eat, I feel burning and I'm burping a lot, it needs to be checked out because it could be Helicobacter pylori. And a lot of people, everyone needs to be their CEO of their own health today. You don't wait for a doctor. You don't need to go see the doctor. Now you can be your own doctor. If you know it's not right, you shouldn't have that. A lot of people have a lot of reflux because they have sleep apnea in the morning or they have Helicobacter pylori. The worst thing to do is you go to a physician and the doctor puts you on uh, a protein pump inhibitor like Prilosec,
Oh,
and
that's the worst.
it inhibits nitric oxide, which is a vasodilator. So it's not great for people with heart disease. It's also not great for blood flow to the heart and to other organs. So when you start taking these medicines, I'll see them and I'll say, "Well, how long have you been on Prilosec for?" "About 30 years." Because they start taking it and they feel good and it stops the heartburn, but they never stop it. The question is, why did you take it in the first place? Because I have heartburn. Did you find out why you have heartburn? No, my doctor just put me on it. So doctors now are starting to change. Instead of just treating with a drug, now they're starting to investigate and figure out why. The problem is when you're in, different types of medicine, you get so busy seeing so many patients. Patient complains, and if you don't give them what they want, they'll leave. But that's not how you do medicine. You really need to find out the source and answer the question, the why. So if a patient came to me with a lot of these symptoms, I'd find out when's the last time you had an upper endoscopy, or did you ever get tested for Helicobacter pylori? So that's a really important thing to do.
I love what you're sharing. Is so important. So let's talk about, hope and all the things that are happening, so much toxicity in the environment. We have so much going on. You're involved in the CEO. Tell me a little bit about something exciting that people can be looking forward to.
So let's just talk about brain health. Okay. Brain health is really important. So usually you get brain symptoms later. You don't get them early unless you have like a tumor or something. But what do you think some of the signs are for brain inflammation? So there was a big study done at Mass General Hospital by Rudy Tanzi, and he looked at Parkinson's patients. And he found out that a lot of people who have these neurodegenerative conditions have inflammation on the covering of the brain called the microglia. And the microglia is our protector. It helps clean our brain at night when we sleep. It's like our housekeeper of the brain. So when we wake up in the morning, we're refreshed, we're ready to go. At a certain point, when there's a lot of inflammation in the covering of the brain starts attacking us and we get brain fog and we're not sharp. We're not focused. We can't concentrate. We forget things. And a lot of people, think that's okay. They think they're just aging, but it's inflammation. So a big part of what we do is we look at certain diseases. We look at brain disease, cancer, metabolic disease, and heart disease. Those four things. So brain health is very important. There's certain things that we can do that we're finding out now that as you age, your hippocampus in the brain it's one of the areas of the brain that starts to shrink and get smaller and atrophy. So we can measure hippocampal size, and that can give us an indication that something's going to happen in the future, sort of like a dementia, like an Alzheimer's disease type dementia. So now there's new therapies, and it's regenerative medicine that we're talking about. You have stem cells, and inside stem cells you have exosomes, the small particles, but they communicate, they're communicators. And what the exosomes do is they want to
Oh,
reduce inflammation and repair and regenerate. So if I gave you an IV infusion of exosomes and I had a device on your head called a focused ultrasound device, I could bring those exosomes from a vein through the blood-brain barrier into the covering of the brain to reduce inflammation. We're seeing this now a lot, and we're doing some clinical trials on patients who have traumatic brain injury, like a lot of sports players or people in car accidents, or just people who have like brain fog and they're suddenly they're not right. They feel something is wrong, and they have a lot of inflammation. Again, chronic inflammation, chronic disease. So these are now therapeutics. So there's diagnostics, early detecting, and then there's new therapies. So biologics are really taking a big step forward now, especially in the state of Florida, because the law changed, and now we can use these biologics, here locally, and that's a really uh, a great thing. Chronic conditions with exosomes that act as signaling messages, and they restore cellular crosstalk, reduce inflammation. They support tissue repair, but they really deliver regulatory inflammation. So in the right patients, they can really reboot and heal.
that's amazing. You got my attention with that. I did buy the exosomes and I did inhale them. And the next day, I forgot I did it the day before. And I went to my bathroom and I'm thinking, there's like a chemical spillage in my bathroom. What is going on? I thought the maid spilled something. It was my own olfactory system got enhanced like 1,000 times just from doing exosomes with a nebulizer.
And that's so exosomes do two things. They block inflammation, and the science, the science behind how exosomes work is they convert a pro-inflammatory biologic mediator like interleukin-6 or TNF alpha to an anti-inflammatory like TGF beta or interleukin-10, and that's really getting into science. But for the audience, for
A
the
lot
audience,
of my audience are doctors, so
they
it's going to
reduce
be okay.
inflammation. I'm the chief medical officer of a company called ZeoScientifix, and ZeoScientifix manufactures biologics, stem cells, exosomes. So I've been using the exosomes in a lot of patients for about 8 years now and treated over thousands of patients on clinical trials for COVID. We did a lot of trials with COVID with exosomes. So if you think of stem cells, let's just go back. We're born with billions and billions of stem cells. The day after we're born, we start to lose stem cells. By the time we're 18, 40% of our stem cells are gone. By the time we're 60, we only have 5% of our stem cells left. So a lot of people are saying, you know what? I'm figuring this out. As I'm getting older, I'm losing my stem cells. Why don't I put my stem cells back? So some people go outside the country to get their stem cells. I did. I went to Costa Rica for 3 years in a row and got stem cells. And you can measure your age. I measured my biological age and I got reduced by about 20 years. That's what we're seeing across
Wow,
the board, 15 to 20-year age reduction getting stem cells.
that's phenomenal.
And we're
It,
collecting that data now because we really need to publish it. So I don't like to make claims. I like to really do science. So we've done about 17 emergency use indications for these exosomes, which are inside the stem cells for COVID. Now, COVID was a big inflammatory disease, especially in the lungs. And when you inhale it, and you see a reduction in many different modalities. Your blood test improves, your x-rays, your imaging improves, your health improves. We did a study in the ICU at one of the hospitals with 10 patients, and we gave them IV exosomes, day 1, day 3, day 8. These were people in the ICU, intubated, more than 21 days when the COVID crisis was occurring in like 2020. And their brain function was down, their kidney function was down, their blood tests were horrible, their x-rays were no good. So we saw in 7 out of the 10 patients, their kidneys improved, their brain function improved, they got extubated, they walked out of the hospital. This was a big deal. So when you have a disease that's so inflammatory and then you prove it with these exosomes, so we started using these in osteoarthritis of the knee. And now we're starting a trial with the Mayo Clinic coming up with COPD. But we have people who had long COVID. They had, damage to their lungs, and they're using inhaled exosomes. So we're putting together these clinical trials, and the research is great. But now because of AI, and there was a big article just today, when you start mixing AI with the clinical trials, you start to get answers quicker. Usually it takes 10 to 15 years, but now you're getting things faster. The whole thing is safety. You want to make sure they're safe. Stem cells are cells, but exosomes are proteins. Exosomes are communicators and not cells. We've not had one problem using exosomes, not one serious adverse event using exosomes in over 1,000 patients. Stem cells, you need a good source of stem cells. So usually a woman would go through her 3rd trimester of pregnancy, deliver a baby, and in the hospital, and the doctors used to throw out the placenta and throw out the amniotic fluid. Now they're keeping those and the umbilical cord, sending them to specialized laboratories where they're going into the umbilical cord, which is about 2 feet long, believe it or not, at a full-term pregnancy. It starts to form day 5 of conception. And inside the umbilical cord are 2 arteries and a vein. In the vein is the umbilical cord. That's where you see a highest concentration of stem cells in the umbilical cord blood. But also, there's a gelatinous substance in between the arteries and veins in the umbilical cord called Wharton's jelly. And a lot of people hear about Wharton's jelly. And that has a very high concentration of what we call mesenchymal stem cells. The placenta also has stem cells. The amniotic fluid also has stem cells. And all these also have exosomes. So what do you take? So if you have a partial rotator cuff tear in your shoulder, you need to fix the structure because you have a tear. Stem cells work great for that. But if you have a lot of inflammation, usually you do after an injury, exosomes help for inflammation. So I would recommend combination therapy, exosome infusion or stem cells. So the question is, do you inject stem cells in the joint or just do it IV? So you have to make sure the source is really a good source of stem cells. Does it come from a mom who's clean? Did the doctor check the mother's records? Did you check for viruses in the mom to make sure those cells are passed, through the baby are okay? So that's very important. The laws are very strict in Florida now. It's not the wild, wild west anymore. Only a doctor, an MD or DO can give stem cells. Before, a lot of nurse practitioners were trying to do it, and chiropractors were doing it, and non-physicians were doing it. That's really, it really should be a physician directed. You have to make sure that, the patient sign a consent. These are not FDA approved therapies, stem cells. That's really important. They're non-FDA approved therapies, but they're allowed in Florida under this new statute. So, you have to check what's called a post-thaw viability test. What that means is when the stem cells come out, they get frozen. When they thaw out, you have to check and see if they're viable. A lot of people are giving stem cells that are not viable. So, there's certain strict guidelines. And right now, the states and the FDA, they're really enforcing the law. So, you can get a felony. Doctors can get felonies for doing this wrong. So they're very careful. So that's why certain facilities need specific certifications, like ZeoScientifix. You need an FDA registered facility. You have to have certain, guidelines to make sure that you're following all these guidelines and steps being made. So, you just need to find out what your source is. That's the biggest thing right now, is source. Outside the US, you don't know where they're coming from. So, we're so happy now we can do it in Florida, and it's changing the way, we're practicing medicine. I've injected many knees with this trial we were doing for osteoarthritis of the knee, and these were people with stage 4 osteoarthritis. So
Wow.
doctors used to say you have bone on bone, there's nothing you can do, you need surgery. It turns out exosomes connect each other through a special tubule. It's called a TNT, tunneling nanotubule. So they're able to go into areas that are avascular. Avascular means no blood supply. So if you're in your cartilage where there's no blood vessels, the exosomes can go in there and regenerate that cartilage. Before, it wasn't known. So now we're starting to see regeneration. And this is after patients would get an exosome shot. Their doctor told them 2 weeks, they're going to need knee replacement. Meanwhile, they waited. I just saw a patient 2 years later. They feel amazing, and their knees regenerated from exosomes, because they can go into spaces without a blood supply and they can regenerate it. And there's a lot of doctors who like PRP. So PRP stands for platelet-rich plasma, and we draw your blood, we spin it down, we give it back to you, but we really don't know what we're giving back. So there's a new way to look at it. You can draw the blood, send it to a special lab like ZeoScientifix, and what they do is they concentrate it, they check it for bacteria, and they make sure there's a lot of exosomes in there, and now you're getting it back. You're getting a concentrated specimen. So we compared PRP with these second-generation type PRP called PPX, and we've seen amazing results. 5,000 patients with PRP back in the day, and half the time people would do better, half the time they didn't. I'm a big fan of the newest regenerative biologics. You don't want to do 1980 technology when you have 2026 technology. Part of what I do is I search around for the hottest, newest innovations, and the regenerative biologics are changing the way doctors are practicing medicine. And I'm excited for Florida because they really took a step forward. I think other states are going to follow shortly for regenerative biologics, but that's great. Also filters. Filters is another therapeutic thing that we do. So if you think about it, plastics, we're doing autopsies in patients, and we're seeing in blood clots full of plastic. So plastics are a problem. Immune complexes are a problem. People with MS and other diseases have these autoantibodies that these filters can remove. Therapeutic plasma exchange is great. There's a lot of research on it. EBU is not FDA approved. A lot of the biohacking places are doing EBU. I'm not a big fan of putting ozone in your blood. I think that things need to really be kept science. And a lot of times there's a lot of mix. Well, unfortunately, on social media, there's a lot of people and they're friends of mine, biohackers, and they're promoting products. And people looking at it and they're saying, okay, let me try this, let me try that. There's certain things that really do work, like photobiomodulation, red light therapy, saunas, removing toxins.
I love that. So I agree with you. I started doing plasma-rich growth factors on the jaw like 20 years ago. And, I was not able to do cancer patients prior to that because they were not healed. People were not healed. People on chemotherapy, people that the immune systems were compromised. And, it progressed from PRP to PRGF. And now, what you're doing, the exosomes. Now, in terms of the price viability, what do you see in the future that being more accessible to the general public? Because I think that that's the way to go to regenerate with your own exosomes.
Yeah, so you have to be very careful. Before anyone gets any of these biologics, you need to make sure that they have baseline testing. Right now, we have certain guidelines. So if you have a history of a cancer or malignancy within the past 5 years, we don't recommend biologics. Other
Yeah.
centers use 2 years. We're doing a study with a integrative oncologist in Boca Raton, Florida. I'm not going to mention his name yet, but we're doing a study with him in cancer using exosomes that we got an approved clinical trial on. So we're going to start actually collecting data using
Mhm.
exosomes for cancer. Right now, there's no data. So, we think that maybe exosomes can move cancer. So we don't know.
Mhm.
So we're recommending if you have cancer, do not get stem cells or exosomes.
Yeah.
You want to
So
be
we have
cancer free.
right. So I'll continue to do my 1980s technology PRGF.
Well, no, I would. Well, do you only see cancer patients?
No, no, no. My patients are, worldwide, international, whatever
Yeah,
medical
so I
history.
would
We
do
have a lot
basic.
of
You
people.
could do some
Yeah.
basic testing. I mean, a CRP is an easy
Mhm.
test to look at to see if you have
Okay.
inflammation or a SED rate. I would do
Yeah.
a complete metabolic profile. We have certain recommendations and protocols. Not everybody needs a whole body MRI.
Yeah.
When you take a history of someone and their history is okay and their exam is normal and basic blood tests like a CBC, a metabolic profile, and some
Mhm, we do
inflammatory
that.
biomarkers are okay,
Mhm.
and the PSA is normal, and there's no other indications of malignancy, you should be happy to you should be okay to give like a biologic if it's indicated. So the indications are pain, wound care, and
Mhm.
orthopedic issues right now that are
Wound
legal
care,
in
that's
Florida.
good. Wound care, okay. I can do wound care. I'm doing a lot of surgeries. Yeah, no, our clients are, people that are seeking your kind of medicine, right? They are doing everything right. They're just, trying to have optimal level of health. We request all those tests. CR reactive protein, we want to know where it's at before baselines, before we even touch the patients. So
Mm.
that way we can document, 10,000 people that had root canals done, and then they have DNA biopsies, and I have the data of what kind of bacteria was in each one of those and the correlation of, organ versus bacteria versus medical history. So we are very interested in integration. Now with AI, I'm so excited because we can put all that, information. The C-reactive protein was whatever 50, and now it's 0 after this procedure was done. So we are trying to look for correlation and then document, what is it that the change was in their lab works, or, if they did prebiotic, probiotics, how did the candida that was foaming from their mouth because they had mercury. We have patients that literally have foam coming out of their mouth because of the amount of dysbiosis in the mouth, causing dysbiosis in the gut. I had a guy that we had two suctions just trapping the yeast coming out of the mouth. And then when everything got cleaned up and regulated, and he got on probiotics, prebiotics, and detoxification protocols, he was no longer choking with his own saliva coming like a volcano out. So, I'm like the person that is in the field, putting out the fires, but we do appreciate so much what you do because, I just want everybody to be like you.
I just want to comment on one thing you mentioned about inflammation and cancer. So there's a company in Germany called Track, and there's other companies in Philadelphia, but they do tests called circulating tumor cells. So they can measure
Mhm.
in your blood circulating tumor cells, and it's pretty accurate. So these people who had cancer and they got treated and then they go back to measure their circulating tumor cells, they're seeing that their tumor cells are going down, obviously because they're getting treated with immunotherapy or other forms of therapy for cancer therapy. So their immune system is getting better, their inflammation is going down, and their tumor cell count is going down. Correlating with the tumor cell count going down was the CRP and SED rate, ESR, erythrocyte sedimentation rate, or the C-reactive protein level. We're tracking the circulating tumor cell counts. So now a lot of doctors are saying, why send a patient, why send a lab test all the way to Germany to do a circulating tumor cell count? Let me just follow the SED rate or the CRP level. So that's what I mean by doing some baseline testing. If your CRP level is really low, and it's a very sensitive test, if you have diverticulitis or colitis or a gallbladder disease, your CRP will be like 50 or 60, just an infection. It's very sensitive. So I like that as a screening test, and that helps.
I love that. So, is there something that you wish you knew when you were 20 that you want everybody to know now?
You know what? It's funny you say that. There was a study that was published in 1950, and it was in the Journal of the American Medical Association, and it was called the Korean Soldier Study, and it looked at coronary arteries in these kids who were killed in war, and they looked at autopsies on their heart and looked at the coronary arteries, and they found out that in the 20-year-old group, 70% already had coronary artery disease at age 20 by looking at the coronary arteries. 40% had obstructive disease at age 20. So why are we looking at age 40 doing these scans? We should be evaluating younger kids. So there's a whole push now to start evaluations early, as young as 18. And that's what we're doing. We're looking at 18, not with, full body CAT scans, but we're starting to do some preliminary testing and biomarker testing. But if I would have done something for me, I would have did this test because I had 5 calcium scores that were 0. And I've been exercising since I'm 13. And I thought I was bionic. And when I came to do my testing at Fountain Life, and I did a heart scan with artificial intelligence that actually looks in my coronary arteries, and I found out I had coronary artery disease. And I thought that I didn't because my calcium score was 0. And then I figured out that you don't really get calcium until you're older. So all these screening tests using calcium scores are obsolete now, and there's doctors still pushing it. It's not a great test. It doesn't find early disease. It finds late disease. Our goal is to find early disease. So if I could change something, I probably wouldn't have gotten calcium scores all through my 20s and 30s. I would have did other testing to see, but I now found my disease early enough that I reversed it. So now I melted away plaque. So if you find coronary disease when it's not calcified, when it's just soft plaque called non-calcified plaque, you can melt that away and prevent a heart attack. No one should have a heart attack today with this technology.
I love it. So let's talk about lifestyle because obviously you know how to prevent all these things. So what would you say lifestyle? Tell me what Dr. Shapiro does, or at least you're shooting for as a goal.
Exercise, exercise, exercise. One of the most important things, you must exercise every day. And you need different types of exercise. We used to do a high intensity interval training or HIITs, Orange Theory. And, I'm finding out a lot of people get injured when you do this. We're starting to do what's called lactate threshold stress testing. So we measure your zone 2 training level. So we'll do a lactate fingerstick blood test on the treadmill every minute, follow your heart rate, and measure your lactate level. When your lactate is between 5 and 6 on the treadmill, we look at your heart rate, and that's your zone 2. At zone 2, you're burning fat, building muscle. When you do high intensity interval training, you're breaking down muscle. If muscle is the largest longevity organ, you want to build muscle. So zone 2 training 3 to 4 times a week is great. Usually the heart rate's about 104 to 107 in most people, not 150 or 60 when they're doing high intensity training. If you found a hill and just walked up a hill, side hill, by the time you get to the top, your heart rate's going to be 110. That's a good zone 2 workout. And you should probably do 10,000 steps doing zone 2 or 3 to 4 times a week. So that's one of the things. Then one day a week, you can do a high intensity interval training. Weight training is important. So it's both, zone 2 and then weights. Weights, I try to do 3 to 4 days a week, different body groups. And I have a group of 3 or 4 guys who we do it together early. If you don't do it early, it doesn't get done. You need to really be accountable. And if you have 3 or 4 people, then they're all pushing each other. So it works out good. You need a group. Sleep is really important. You need a minimum of 7 hours of sleep. Not 6 hours, not 4 hours, 7 to 8 hours of sleep. Sleep is really important because sleep has a lot to do with your brain and has a lot to do with aging. So sleep is really big. Nutrition, you have to watch what you eat. Alcohol, a lot of people are switching from alcohol to these mocktails, these new elixirs that contain adaptogens or herbs, and they taste just like alcohol without the alcohol. There was a few doctors who are neurologists, David Perlmutter, a bunch of them, and they have these, these pictures that they post. Drinking alcohol is like a sledgehammer to your head. Alcohol is really toxic, but a lot of people love it. I mean, red wine, 1 or 2 glasses is not going to hurt you, but if you have a lot of reflux and he'll go back to pylori, that's going to be bad. So you want to really try to get yourself healthy and not everything in moderation. I'm not saying stop alcohol. People love that drink after work. They go to the bar and have, a nice martini. That's no good because you just don't have one martini. And once you have alcohol, then you start eating bad and you start having the nuts, the crackers, the candy, and you start, one thing leads to another. So if you're training and working out and feeling good, looking at yourself in the mirror and saying, wow, I look great, I don't want to drink and I don't want to eat that piece of bread So you really want to watch the simple carbohydrates. And right now they just changed the whole food thing. I really agree with the new government, what they're doing with food. It's really important. I mean, everyone switched to sugar and bread and pastas, and now it's all back to meats and it's remember, it's the environment that cholesterol's in. If high cholesterol's in a sugar environment from eating breads and simple sugars, that's a problem. And that's why so many people are fat. If you took a picture of the beach in 1930, 1940, everybody was lean, and you took it now, no good. If you went to Walt Disney in Orlando and you just walked around, but there's more people on wheelchairs with edema and obesity waiting on to go on rides. It's incredible. You just can't eat yourself to death, and everything is fried. So nutrition is big. So we spoke about exercise, different types of exercise, strength training, aerobic exercise, zone 2 training. We spoke about sleep, we spoke about nutrition. What else?
What
So,
about
so knowing early detection. So
yes.
first, you can't fix it if you don't find it. So I think people should get some baseline testing, and you can get baseline blood testing. The typical tests that the doctors do in the office that insurance covers. Unfortunately, insurance doesn't really want you to be well. They get money when you're sick. So some of these tests are not covered by insurance, but I think people need to check their gut. They should get a gut evaluation. They really should. I think everyone should have a certain age, a heart scan with artificial intelligence, because the number one killer in men and women is heart disease. 1 in 3 women die of a heart attack. 1 in 33 women die of breast cancer. So heart disease is big in women. And a lot of women think that they don't get heart disease because estrogen is the ultimate protector for women. But once women go through their changes and they don't have estrogen around and they're in menopause, there's a window, a 6 to 9 year window where their arteries in the heart and all their arteries in their body change from a protector to a monster. We have 60,000 miles of blood vessels in our body. The inside lining is the endothelium, and that protects us. And estrogen keeps that nice and open. When estrogen is not there, we have a problem. So a lot of women, they're doing great, but once they reach their menopause, they're equal to men in heart disease, and they get disease. So I'm a big fan of hormone replacement therapy in men and women. And there's big correlations between low hormones and cancer, low hormones and heart disease. Hormones don't really cause what causes cancer is your immune system dysregulation from a poor gut. So there's certain cancers like in the breast that are estrogen receptor positive and progesterone receptor positive, and you can't be on estrogen because that feeds the cancer. But how does cancer start? We all have cancer cells in our body because cancer cells are normal cells gone bad. So if you think of cancer cells and they come close to each other, a normal cell, they repel because normal cells have what's called contact inhibition. When they get close, they repel apart. Cancer cells lose that. They lose contact inhibition. So when they join and stick together, they form a clump, and that's a tumor. So what changes in your body to make yourself get cancer? Your immune system gets haywire because your gut is not right, because we're not eating the right foods, we're not exercising, we're not sleeping. So we start to get chronic inflammation, chronic disease. All stems from what we put in our mouths, how much we exercise, how much we sleep, and how powerful is our immune system. We have one of the most powerful immune systems in the world. And the problem with cancer is cancer hides from our immune system. It forms a lead shield over a cancer cell. There was a big study in Duke called the Duke glioblastoma multiforme study. And we're talking about brain cancer. And brain tumors are like the worst. If someone has brain cancer, it's like 6 months and that's the end. It's difficult disease. A lot of people get it. They did a study with a polio virus that they inactivated, and they were able to take this inactivated polio virus and give a therapy through this virus, and it took off that lead shield, and the tumor was gone in 3 days, but it kept damaging the rest of the brain. So there's still a lot of research ongoing. There's a lot of stuff we see online about cancer therapy and new treatments for cancer. There's a doctor in Saudi Arabia who just got approval for this drug for bladder cancer, and he thinks this can work here. So we're actually looking at these things. We're doing a lot of stuff, believe it or not, with gene therapy. And we can take an exosome that I mentioned before, put it in a gene, and move that gene to a certain area to cure things like Alzheimer's disease or ALS or MS. There's a lot of things that we're starting to do now in clinical trials, and that's really what you want to do. You want to make sure everything is safe. You just can't do human experiments. So a lot of this needs to be done through trials. And now because of AI, we can really do a lot trials quicker.
Wow. So I love the conversation because you are so comprehensive. You went from the brain all the way to the gut. and exercise. Tell me a little bit about, the impact of electronic magnetic frequencies and then all this 5G and, all the vaccines, all the metals in the body. What's going on? And have you seen an increase on neurological problems after the 5G? Because you're a doctor before 5G. So have you seen an increase on, all the cognitive stuff in any relationship of studies of 5G that you know of?
So sometimes you see people with that ear thing in their ear all day on their phone. There was one guy that had one that connected under his chin to both ears.
Mhm.
That was the guy who got the brain tumor, who I saw. And they showed you some MRI images of when you have this Bluetooth device in your ear, you can look at the brain tissue and you can just see what's happening to the brain getting heated up. There's other people who I just heard 2 days ago, Peter Attia. He was on 60 Minutes, and the same, ask him that question. He says, no, it's not relating. It's nothing. He said it wasn't, there's no causal factor. You know, I'm not so sure about that. I think that, I have patients who use that earphone a lot, and I tell my kids, don't use it, use headphones, don't put those earbuds in. I mean, until we see more data. I don't think it's that powerful enough to cause disease, but I think we need to see. It's too early. They just started 5G. You may not find out for 20 years down the road. But again, everything in moderation. You don't want to really stick something in your ear all day long and be on the phone all day long. You don't want to sit in front of a computer and do Zoom calls all day. You want to walk
Right.
around.
Balance,
Yeah, it's
having
just
balance.
moderation
Yeah.
with anything. I mean, my answer to that was maybe it does, maybe it doesn't, but don't wear it all day.
Right. Yeah, we had a patient that came, he drove 5 hours away. He had, titanium implants placed and, porcelain fused to metal bridge, and he said, "The moment that they put the metal in my mouth, I cannot be next to my computer." He started shaking, and then the surgeon that put the implants would not remove it, and I told him, "I believe you. Why would you make this stuff up?" So I removed the titanium implants, I removed all the metal in the mouth. Obviously, I told him, you better, get it with a neurologist, somebody that can rejuvenate your brain, because obviously there is something happening, that you pinpointed to that event, but most probably you had toxicity, inflammation on your brain before that. So that was like the icing on the cake. So, having metals and it's almost like you become an antenna, with the EMF and having all these metals in the mouth.
Getting back to the mouth, the oral systemic connection, so systemic is throughout your whole body and the mouth. So how can the mouth stall a healing process if you think about it? So you're a dentist, so but most dental surgeon, so most doctors, they don't even look at the oral cavity. But the oral cavity is the most overlooked source of chronic inflammation. There's infections, there's unresolved dental issues, cavitations are really big right now, a lot of periodontal disease and gum disease, and these go into the bloodstream and it travels everywhere. So you could be doing everything right. You can sleep, you can exercise, you can eat well, but if your oral environment's inflamed or toxic, all healing stops. So if you really want to recover and be healthy, you need to make sure you have a clean mouth. Also, everything needs to be working together. You mentioned detox, oral health, but if your gut is not good, or if your immune system's not good, if you're not regenerating your system, you need to do all this. You just don't want to feel better. You want to become resilient. You want to be able to fight. You want your immune system to be strong. So the trajectory is going to shift from decline to recovery when everything is working together.
Thank you so much, doctor. How can people find you, reach you? How can they get the exosomes? Yeah, give us some information. We're going to have it on the resources. I'm so, so grateful that you took time to speak to us.
Yeah, I think if they go to ZeoScientifix with an X, I think you can see it on my background, the name. That'll give you some of the science. Take a look at some of the science. We're working with some local doctors like yourself, so they can go to you and get some, in your office. If there's an MD or DO in your office, you'll be able to do it there. I think you do have, you know, physicians in your office. There's other doctors that we're working with in Miami and West Palm Beach right now who we're able to send you to. So we have a few locations in South Florida.
Thank you so much, doctor. So I just always close in a prayer, and we believe that the biggest energy and the biggest healer is God. In the Old Testament, in Psalm 103 says that God heal all our diseases. We had a lot of miracles, but we appreciate you as a human being dedicating your life into moving science forward And I'm so grateful. Heavenly Father, we thank you for Dr. Shapiro and his passion that you have given him purpose. Nobody can be so passionate about somebody or something unless they have a purpose. So we thank you that his life is a life driven by purpose. And we thank you that you give him the wisdom, you give him the passion, and somehow all the energy because he does a lot. So we pray over his life and his projects. And we thank you for this beautiful day that you have created. And I pray that you protect us as we move forward and give us wisdom with our patients. Amen.
Thank you. I want to tell you a story before we finish
Yeah.
about what you just did. I took care of a patient who was a minister in Texas, and he would fly to see me from Texas. And he had a large ministry. And he came in, and before he left, he took all my staff in a circle, grabbed our hands, and did a prayer just like that.
Yeah. Well,
And when you
remember
look
that.
into his eyes, it's like you saw God in his eyes. He was like different
Yeah.
than other human beings. He was
Yeah.
like, not that he was possessed, he was, really, I mean, it was
The
incredible.
Holy Spirit. Yeah.
Yeah.
So, we operate at different levels. So, when I speak to my patients, I always ask them, if they're terminal, do you believe God can heal you? Because I know that I'm only a carpenter, just removing toxins. But the real true healer is the one that made that sunrise this morning and the one that is making those waves rise and the weather. God is in control of everything. So, when you're looking at the RNA messengers, he's smaller than that. You cannot see him, but he's operating. And most probably what you saw on the doctor of the patient that is a minister is the presence of the supernatural spirit of the Holy Spirit. The Holy Spirit lives in us. So your body is the temple of the Spirit of God. So that's why I'm so passionate about helping people taking care of the temple because the temple is where God can manifest, but if it's ill and if it's not functioning, you cannot do life full out, or you cannot play full out. So I know that you're competitive since you were young and you're still competitive. I love that God has given you that spirit of of getting to the next level and to the next level. But when you continue to explore the MRI and the exosomes, you're going to see the invisible. That's the part that God is in charge of, and it's pretty powerful. So I thank you so much. I'm going to see you on Friday at
Oh,
the
excellent.
exosome. I'm looking forward to seeing what new discoveries you have.
Okay, great.
Thank you so much, Dr.
Okay,
Shapiro.
take care. Bye-bye now.
Okay, bye bye.